Throughout our 22-year history in Somalia, MSF has negotiated with armed actors and authorities on all sides. The exceptional humanitarian needs in the country have pushed MSF and our staff to tolerate unparalleled levels of risk, much of it borne by our Somali colleagues, and to accept serious compromises to our principles of independence and impartiality. But we have reached our limits.
The move proved devastating. Thousands of Somalis were cut off from humanitarian and medical aid virtually overnight. MSF described it as one of the toughest decisions in its history, citing the killing and kidnapping of its staff, as well as countless attacks on personnel, property and equipment as reasons. One of the hospitals MSF used to service is in Dainile, on the outskirts of Mogadishu. This area saw some of the worst fighting between insurgent group Al-Shabaab and the African Union and Somali government forces.
MSF took control of this hospital. So it helped a lot of people and it saved a lot of lives when the civil war was going on. It served across the Somali people and it helped.
More than a year after MSF withdrew, a local member of parliament invited us to tour the facility. What we found was extremely surprising. Despite major challenges and a budget of almost zero, the facility is still functioning. The wards are filled with people receiving treatment free of charge. This little boy was brought into the emergency room after an accident with boiling water. And in the men's ward, 39-year-old Jamam Hirabi is being treated for a gunshot wound.
The surgeons and staff who work at this hospital are very good. That's why I came here. Other places ask patients to pay for operations, so I couldn't go there. Thank God I am receiving good treatment here.
The pharmacy shelves are well stocked. The two operating theatres spotless. And the maternity ward is full of newborns. So who is paying for these services? We're told some of the money comes from donations. A medical charity run out of Saudi Arabia provides much of the maternity ward funding.
The health service here is provided to all people in the city and the peripheries. And they need more service like this, more and more, because the population is bigger than this service.
However, despite the hospital's success, the need for external help is clear. These patients have been queuing since 7 o'clock this morning. Doctors tell us that every day they see around 150 new patients. But when MSF was here, that number was 8 times as high. Staff say they receive a fraction of the salary they used to, and many are volunteers.
We came here when MSF was here. It was very good, but I'm back now because this is one of the only hospitals that's free. The doctors are very helpful.
Health officials are imploring medical groups to return to Somalia.
MSF did a lot of good things, and the people of Somalia is very appreciative and need their help. So we also request if they can come back to give the services that they were doing for the Somali people. The situation on the ground changed. It's not like before. The Shababs and those people who did kidnapped now are no longer very threat.
Somalia's Health Director General says MSF was the backbone of delivering health services in the country.
After pullout of MSF, there has been a very huge gap in health delivery system that has been established, in which the Ministry of Health and other partners tried to fill by inviting others to come in and take the vacuum. We still strongly feel that MSF shouldn't leave even whatever had happened, which was not really something we were happy with. It was tragic, happened to all of us, to the people who are getting the services, and also to the people who brought the services, including MSF, and it happens to many people. It was not our will, it was not our intention, and it was not but it happened. Now the need is how many people could have been saved if the services could have been continued.
Dr. Farah has urged MSF and other health organizations to review their policies and come back to Somalia, both to support and, in some cases, entirely rebuild a health system on the edge. Robin Creel, Mogadishu, Somalia.